Okay, I'm going to continue. Thank you so much, beautiful people, for joining me. As you all know, my name is Adenike Eketunde, Dr. Adenike Eketunde. Thank you for joining me today. Thank you. Welcome to my channel, EL Domain. As you all know, I talk about health issues. I'm very passionate about health prevention, healthcare prevention, and public health. I've been so busy because of school work, and as you all know, I'm doing my Masters of Public Health, so it's really what I'm very passionate about. So I've been off for a while, and I told people to comment on my last post the topic they want me to talk about. Some sent me a DM, and I decided to talk about anxiety and panic attack. So someone asked me to talk about it, so I'm going to be talking about anxiety disorders today. So anxiety, panic attack, they're all under anxiety disorders. So that's what I'm going to be talking about today. So stay tuned and let's learn together. I'm going to be answering questions when I'm done. So if you have any questions, comment down below. Once again, thank you guys for joining me. I love you guys. Thank you for the support. Let me go straight to the point about anxiety disorders. So the reason why I'm talking about anxiety is because it's a branch of like mental illness, and mental illness is one of the underdiagnosed disorders worldwide, both in developing countries and developed countries. So a lot of awareness have to be done on mental illness and the reason why people behave in certain ways. The reason why it is very important is because these disorders, they affect the way people live. So it is very important to talk about it. And I'm sure a lot of people want to know about anxiety and panic disorder. What is the difference? Anxiety itself means fear of worry. That is more than the stressor. So it is okay to be afraid sometimes. It is okay to be stressed, to have fear. But once it's more than the stressor, then that's a problem. So what can cause anxiety? Anything, everything, and nothing. So the cause of anxiety is not really known, but there are studies that have shown that it's because of the circuits in the brain, and sometimes it is genetic. Like for panic attack has been linked to genetics and family history. So like I said earlier, anxiety simply means when you have fear that is more than the stressor, that is actually affecting your daily activities. We have different types of anxiety disorder, including panic attack. We have body dysmorphic, we have phobias, we have panic attack, we have obsessive-compulsive disorder. There's what we call agoraphobias, which I'm going to be talking about so that people can know the difference and what to do and how to really prevent it, when to seek the advice of a healthcare professional, and what to do after that. So what are the signs, general signs and symptoms of panic and anxiety disorder? So you have intense fear. So you feel like your heart is literally beating very fast, like your intense fear. I don't know how to describe it, but it is described as intense fear. You have sweating, dizziness, lightheadedness, dizziness, lightheadedness, and it can be so serious that some people actually rush to the hospital. So those are the general symptoms of panic attack, the intense fear. When people have panic attack, that's like more serious than anxiety. Anxiety really means like get afraid of everything in life. We have what we call generalized anxiety disorder, which I'm going to talk about. I just want to talk about panic attack right now. So when people have panic attack, they literally feel like they're dying, like they have an heart attack. But what the difference is that it occurs in younger people. So heart attack, which is a cardiovascular disorder, occurs mainly in elderly people and middle-aged people that have heart issues. So these young people about my age have intense fear of them dying. They literally feel like their heart is like beating very fast, and they have sweating. Some people have dizziness, they start sweating, tremulous, and all those symptoms, and they rush them to the hospital, and they do like different tests on them, art tests, and everything comes back normal with their age and everything. So that's how most people are diagnosed. Most of them actually feel like they're going to die. And in the worst case scenario, people can actually die from panic attack. So apart from the fact that they feel like they can die from the whole sensation and everything, people actually can die from it, because sometimes the heart beats so fast and get tired and can lead to death. So because of the fact that they feel like they can die, most of them, it affects the way they live, because they are afraid to go out, they are afraid to do some things because they don't want this panic attack to happen to them again. So that's why it's a concern, the fact that it's affecting their lifestyle. Some of them get so scared that they don't go to work, they don't go out, because they are scared that once they go out, their chest is going to start beating very fast and they are going to die. But the good thing is that there are some behavioral therapy that has helped people cope with this panic attack. There are drugs that you can take that can help people. So like I said, these are things that need awareness, they need diagnosis, and they need normal treatment, just like any medical conditions. There are people that have panic attack that are living normal life. It's just about how you handle it and how they can cope with it. So they actually feel like dying. That's what panic attack is like. They have heart attack and they want to die. Why anxiety disorder? So I'm going to talk about few ones, like generalized anxiety disorder. I'm going to talk about obsessive-compulsive disorder. I'm going to talk about body dysmorphic disorder and phobias. So phobias really means fear, or specific phobias. So there are people that are afraid of going out. The reason why this is under a mental issues is because these people lock themselves inside. They don't go anywhere. They can be inside for days. So it's affecting the way they live. That's why it's an issue, because we want you to live your best life. So we need to talk about it, right? So we want people to live their best life, and this thing affects the way they live, the way they interact with people. They're really scared of people judging them. And people that have agoraphobia, they are really scared of closed spaces, and they are scared of entering elevators. Imagine you have to walk in a place that there's an elevator. That's going to affect the way they work, because they won't be able, once they enter, they will start having palpitations and all those symptoms that is very, very uncomfortable. Like I said, once you have these signs and symptoms that is affecting your daily activities, there are drugs, there are behavioral therapy. There are also people that are afraid of like heights. That's like the lesser version, because that one doesn't really affect the way they live. Like me, I'm afraid of heights, but like I can still do some height activities. And so some of the behavioral therapy people, they advise people to do is what we call flooding. So I'm sure you guys have seen the video of a small boy that wanted to swim and was literally shaking, and at the end of like 2 years he was like a pro. So they expose you to these things that make you scared. So if you're someone that is afraid of height, then they start exposing you to activities that includes height, and you start seeing it every day, and with time your body start adjusting to it, and this fear and palpitations and all the symptoms that comes with anxiety start going away. So that's another form of anxiety after panic disorder that is really, really serious, and you think you're dying. There's also what we call generalized anxiety disorder. This is actually very common, especially among women, because we worry about everything. So these people worry about school, they worry about work, they worry about things that are not happening, things that has happened before. They worry about everything, and it's affecting them because they know that something is wrong. There are some things they are not supposed to be worried about that they keep worrying about. So that's why this is a serious concern. They worry about everything. And like I said, these mental disorders are not something that is just diagnosed because it occurs once in your life. These are chronic disorders. So it takes about 6 months and above before any professional diagnosis of most mental condition, especially anxiety and panic disorder. Panic disorder, it must have happened to you like a couple of times, and you have all the symptoms with, and it starts affecting your behavior of going out, the way you live. Obsessive-compulsive disorder, which is quite common among, I'm sure people have heard about that one a lot. These are people that are excessively clean, not really clean. So most times it occurs in people that are extremely clean. They actually have to leave their things where they kept it. Like once they don't do that, it's like compulsion. They start getting scared, anxiety, and it's just like compulsion. Part of People, I don't know if you've heard about Tourette's syndrome. These people have tics, so they have the compulsion to say some things, to do some things, sometimes to sneeze. There's what's called coprolali, where they like insult people. These are compulsion, so they are compelled to do this thing. So this thing is affecting their way of life because they don't want to do it, but it's just like an urge that they can't control. And like I said, there are behavioral therapy, drugs, and some other things that you can do if you go and see your doctor to help control the signs and symptoms, and they can live a normal life. They can live a normal life. Having a panic disorder, having anxiety disorder does not mean that you can't live a normal life, or if you see someone going through something like that, you have to like make gestures of these are faces in people's life, and sometimes it comes and goes. So that's all about anxiety and panic disorder. Let me see if I have more to say. You know, most of the time after talking, then I remember, yes, there's this thing I want to say, I did not say it. I'm trying to remember. I've talked about, yeah, there's what we call body dysmorphic disorder. So these people are obsessed about the way they look. They just feel like there's something wrong with them, whereas there's nothing wrong with them. So it's also part of anxiety disorders. So the most common is really generalized anxiety, people that worry about everything for a long time, panic attacks. What else? Yeah, that's it. So let me start answering questions. Let me see. Difference between anxiety and hypertension, please. Okay. Hypertension is a medical condition that there are different types of, hypertension is divided into two. You have the essential and non-essential hypertension, secondary hypertension. The essential, we don't really know the causes, maybe lifestyle. We have modifiable risk and non-modifiable risk, which includes obesity, stress, and all that. And we have done some medical conditions that can lead to hypertension. Also, I forgot to add this. There are some medical conditions that can cause anxiety that has to be ruled out. Example include hyperthyroidism. So hyperthyroidism can mimic anxiety. So that's why I said if you have the symptoms, you have to see your doctor. They can do some tests. So hyperthyroidism is a medical condition that can mimic anxiety, which is a mental issue. So hypertension is a different thing. It's okay, let me see. So I'm trying to differentiate with anxiety. So hypertension is a medical condition that causes your systolic blood pressure to rise. That is something affecting your blood vessel, hypertension. So there's increased pressure that your heart has to like pump. Your heart has to do more work against the blood vessels, and it increases your systolic blood pressure. And this is a medical condition that can lead to systemic diseases, like it can affect your eyes, it can affect your kidney, your organs. These are medical conditions, and the causes are, like I said, we have different kinds. Most of the time the causes are not known, and it occurs in older people. Hypertension. There are some secondary causes of hypertension in younger people, like what we call pheochromocytomas, some tumors, and sometimes stress and some fibrodysplasia that can cause hypertension in younger people. But like I said, it's a disease of the older people that affect the blood vessels, and it is a medical condition, unlike anxiety. Anxiety really means that you're scared, not like your blood vessels or your organ is having an issue. It's more like fear. It's more like things of the mind. That's why the treatment, like I said, is more of behavioral therapy. Like I said, if you have serious panic disorder, at that point, it can lead to death. Even though it's not as common, it can actually lead to death if it's very, very serious, because you just feel like you're literally dying. That's why they get to the hospital, they give them some drugs to calm them down. And yeah, but it's not something that is like as a result of medical conditions like diabetes, hypertension, that we know that weight gain reduces, weight loss, exercise, and all those things can reduce it. Well, there are some behavioral therapy to help with anxiety, like practicing being calm, positivity, motivational book, having good family, support and all that. But yeah, that's the difference. Okay, let me see. You're welcome. Joanna. Why so serious? Thank you. Miss Perfect. Thank you. Okay, thank you so much for joining me today. For those that are not here today and would like to watch the video, yes, like I said, anxiety can happen at any age, but it's more common in middle class people. But yeah, it can occur, and it can even happen to older people, but it's more common in younger people. Any other question? Any question before I leave? Hello. Okay, I'm going to be posting this video on YouTube for this month. I've been so busy with school, like I said earlier, but when I'm like free, I have a very nice video I would like to show you. I'm going to be posting that next month, hopefully on skincare routine with a dermatologist, and she's really good. I'm going to be posting that next month. For this month, I'm going to be posting this video for people that are not online to watch me, to ask their questions. I'm going to be posting it, so keep supporting me. Stay tuned. Love you guys so much. Bye.